Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on nut allergy under the section of Immunology. So what is a nut allergy? Well, it's an IgE-mediated mast cell degranulation triggered as a result of contact with peanuts and or tree nuts. And the disease is significantly associated with asthma, hay fever, and eczema. Nut allergy is really quite common in atopic individuals, and usually it manifests itself in early childhood. The signs and symptoms of nut allergy is really quite similar to any allergic reaction or anaphylaxis reaction. And if you want an in-depth review of those symptoms, please feel free to click here to watch our video on anaphylaxis. However, just as a quick recap, it would be accompanied by lip tingling, wheeze and stridor, facial, tongue and or throat swelling resulting in angioedema, hypotension, and syncope as a consequence, as well as urticaria, which is that classic itchy rash that is widespread. The investigation of a case of nut allergy is really down to the history. So taking a detailed history is key, and the rest of the investigations is similar to any type of suspected allergy. That includes a mast cell tryptase level within 6 hours of presenting with symptoms, doing a skin prick testing, and specific IgE measurements. There could be a possibility of oral challenge if there is diagnostic uncertainty. However, it's really important that this is done under strict measures and in somewhere with trained personnel and access to resuscitation facilities. So in case of a true anaphylaxis, the patient could be resuscitated promptly. The management is, again, as per the anaphylaxis guideline. It's really important to have an understanding of the disease, which would also help with long-term avoidance of the trigger. It would be really crucial for the patient in hospital to wear a medical bracelet to alert all the other healthcare workers about their allergy. Patient education would be key, and therefore having them carrying long-term EpiPens, at least 2, in case one of them is out of date or doesn't work or is not enough in terms of resolution of their symptom, really is crucial in terms of management of somebody who has got nut allergy. So let's do some questions now. An 85-year-old lady with a known history of an allergy to nuts and peanuts developed signs and symptoms consistent with anaphylaxis after receiving treatment for constipation. Which of the following is most likely to be the culprit on taking the history from her care home staff? Options are A. Phosphatenema, B. Senna, C. Lactulose, D. Arachis oil, and E. Movicol. And the correct option in here is arachis oil. This is somebody that those of you who have an interest in gerontology probably are already aware of this, but arachis oil is nut-based, so it's really important to be avoided in patients who have an allergy to nuts or peanuts. It's fair to say that all of these options can be used as laxatives for treatment of constipation, but arachis oil is the only one among them that contains nuts and therefore is the correct option in here. Thanks for listening to this episode of Bite-Sized MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.